Hey everyone, welcome to the Business Minded Sports Physio Podcast. My name is Brian Schwabe, board certified sports physical therapist, entrepreneur, and co-founder of the Student Physical Therapist. I worked with elite athletes for over a decade and currently serve as the director of IO Sports Therapy, working side by side with high performance coaches, NFL and NBA skills trainers, and sports agents on a daily basis. I'm also an author, sports medicine consultant, course creator, speaker, and concierge sports therapist, traveling with professional athletes and celebrities. I created this podcast to share my experience as a sports physical therapist and entrepreneur so that I could give you everything you need to know to cash in on your passions, monetize your expertise, and create your own career Super Bowl. With that in mind, welcome to the podcast.
Hey everyone, welcome back to the podcast. In today's episode, we talk with Jesse Elis. Jesse is a dual board certified orthopedic and sports physical therapist, certified orthopedic manual therapist, and strength and conditioning specialist. He's an expert sports physical therapist who has served as both the director of physical therapy at Exos in Phoenix, Arizona, and a director of player health and performance with the Portland Trail Blazers. You may have heard him on a few other podcasts, and I'm excited to have him on this one. Jesse, welcome to the podcast.
Hey, thank you for having me. I'm excited to talk a little bit about the worlds that we both kind of live in between the private sector and pro sports.
Absolutely. I think there's a lot of good dialogue to be had on that. I know we've had some brief dialogue in the past, but Why don't we start a little bit about, tell me and the listeners about your background and your story about your journey.
Yeah, I mean, let's go back to the time where I was sitting in North Dakota wondering what I'm going to be, what am I going to be when I'm going to grow up. So I decided to go into PT. My mom had MS. And she said, hey, you need to come to rehab with me. I think you'd be good at this. So that was kind of my introduction. Went to school at University of North Dakota, got my doctorate in 2009. And then I talked to my wife and said, what are the chances of me with zero network in pro sports or working with athletes? Where would I need to go to at least elevate my chances? So we moved down to Phoenix, where there's a plethora of different opportunities. But the number one goal was to get into Exos. That was that was Mecca. It was something new, and it had this collaborative spirit between nutrition, performance, PT. And I was like, man, I got to get there. So I worked in just your general mom and pop clinic for a while, slinging patients, seeing 30 a day, scratching my head saying, is this the real thing I should be doing? And then sought out some good mentorship and learned a little bit different way to approach care. I did a fellowship, which you forgot. So I'm a fellow as well in the orthopedic manual physical therapy, which I'm just going to say I cried many days from all the abuse I got from my mentors and even my cohort. So it was worth the grind. That was a 3-year postdoctorate program from Evidence in Motion. And then after the 9th interview for 9 different spots at Exos, they somehow gave me some part-time opportunity, which then after a year of working my butt off and showing that I'm worth something, I became director of PT and oversaw the 5 facilities. So I'm kind of like the Eli Manning of PT. I can throw like 4 or 5 interceptions, but still win a football game. I've gotten a lot of no's in life, but I just keep working hard.
That's awesome, man. That's a good story. I think that a lot of people that listen to this probably don't realize how many no's you have to get in order to get some yeses every once in a while, right? And there's more no's than yeses. Would you agree?
There's way more no's, and everyone takes everything so personal. You're not friends with everyone, and you're not the right role for every position that you apply for. You learn. You understand that culture, and there's things that they're looking at, and sometimes you just don't match up. Yeah. So you just can't take it personal. You just kind of brush it off and go to the next opportunity.
I love it. All right. Well, I'm going to hit you with a question that's been on my mind for a while right off the bat, and then we'll take it wherever we want to. But, you've worked in private sector, professional sport. What do you feel is the biggest challenge in a professional sports team's performance medical model?
Can I just give one, or do you want a list? I'm going to
give me something.
I'm going to say imperfection. That, I mean, you think of pro sports as the elite of the elite, the hyper qualified staff, the open checkbook where you can buy any piece of technology that you want. And the kumbaya of culture. Like, hey, we're going to go to war together and we're going to do this. It's not like that. This is, it's an imperfect world. You can fall on the sort of idealism if you want. You're either going to end your career quickly or you're going to go insane. So when you walk into the doors, just know that 100%, you're only going to get about 60% of your vision, and be okay with that. It's a byproduct of the environment that you live in, which is weighed heavily based on power dynamics, the subcultures of the general overarching culture of the team. How do the subcultures collaborate and work together between coaching and medical to performance, or just upper management and medical? Like, how is that cohesiveness work? And then last, the schedule dictates a lot, especially in the NBA. I mean, it's so volatile. The schedule's so crazy where you're playing 4 games in a week. Whatever ideals you think of performance and medical, just throw it out the door. And it's more of a practical or pragmatic way to approach care. It's all about results.
So how do you survive?
Yes. Yeah. So that I think that's the thing. And if anybody's at a podium or they're the director of et cetera, and they're preaching how perfect their model is, I wouldn't buy that. I wouldn't buy what they're selling.
Fair enough. What would you do to change it?
Communicate, and you need to, I mean, everyone is looking at sport differently between management, coaching. We live off contracts. We live on our lifespan is 2 to 3 years. And then are you going to make the next role? So it really just falls down to trust. And you're all striving for the right goal. And then the most important thing is in pro sports, you really have to check your ego. It's not about you. And I think a lot of people think when they get in the league, they're like, oh man, I got the best job. I'm the man, or I'm the female, that this is awesome. And then it's not about you. It's about the athletes. And that's really when it comes down to it.
Yeah. You know what? It's a really interesting viewpoint, right? From somebody who's been in it, but you mentioned communication, right? Everyone talks about that, but let's take a deeper look at that from your perspective, right? Let's talk about how you have learned both the good and bad of communication in pro sport, and how do you communicate amongst different stakeholders, right? You've been in that role. You've also been in that role in private sector, which is a little bit different. I think we could probably have a discussion on that as well. But how do you communicate between performance, medical, management, athlete, skills trainer? And I know that's a loaded question, but can you maybe give us a brief example of a time you had to communicate to different stakeholders, which you had to do on a daily basis, I'm sure, but what was that like, and what did you do that you thought was the right thing to do for that?
Yeah. So there's one example. I mean, I can go into some generalities, but for an example, there was an athlete, a player that I was having a hard time connecting with. And anytime the director talks to any of the players, it's, anxiety is dialed in. It's like, okay, why is this guy talking to me right now? Is he going to tell me I can't play? Of course, my nickname back in the day with the Blazers, it was Grim. I was the Grim Reaper. Like any place I went, I usually had bad news. So, I mean, that was the analogy that I had, which kind of sucks. But
yeah,
that's the reality. I did bring good news as well, but most people just thought of it as bad. But I felt like, how do I connect with this player? Because I can see that there's some apprehension and just some tension. Well, I found out later that if you talk to them in their setting of comfort, which is the basketball court, it's kind of like the white coat syndrome when you're going to see the doctor and your blood pressure is higher, right? If they're in my office and we're talking about prognosis or, hey, how long is this going to take? He's kind of fidgeting in his seat. He's like, he's caught up in this office that I'm in versus, hey, I found out tensions were way different and I got more information and feedback sitting on the bench on the court, which was just like an aha moment. Like, oh, environment matters, even with communication.
Yeah, no, that's good. So what about if that same athlete is injured? Let's say he has a knee injury, and he's acute, subacute, return to play, return to sport, return to performance continuum. During that entire process, can you talk to me a little bit about how you've communicated amongst all those other stakeholders in that process, and what that looked like along each step of the way?
Yeah. So if I'm talking about coaching or upper management, it literally has to be objective. There can't be emotion to it, because you're giving information and you have to be accurate, as accurate as you can be. It's tough to put a timeline and a prognosis to get somebody to sprint, dunk, land on a foot, and be like, that's going to be 2 weeks. That's a hard job to do. It's not getting them back to jogging outside for 20 minutes. Like, they are professional athletes going to war every night. What's the realistic measurement? Well, you need to be objective, but you also have to give some span. Like, this could be the best scenario, this could be the worst scenario, and we're going to live in this continuum. So I think that's an ideal way to approach it, both with coaching and upper management. Now, with your day-to-day interactions with like a strength coach or a performance specialist, well, one thing you got to own, you got to have the same communication. That's critical. We got to use the same words to understand the goal, right? And if we're mixing and matching, and there's just this kind of this vastness between our thinking, that's just not going to work out. And then secondly, there's always a pivot point, especially, maybe it's a little bit better in the private sector, because in professional sports, everything is, it's a little bit more intense. Decisions, everything, basically your work is being shown to the world on a daily basis. So there's more stress to it. But I do feel like with the specialist, there's a pivot point in rehab where they should take a little bit more ownership, and the PT kind of pulls back and says, all right, what do you think we should be doing at this point? And then I'm going to sprinkle in some of my thoughts on whatever restrictions we're trying to still manage. But there's a pivot point of ownership by PT, with the strength coach being more receptive and hearing their thoughts. And then there's a transition. And I think a lot of times PTs don't understand that is a requirement for it to be a nice, seamless continuum of rehab. A lot of times PTs have this a little bit of arrogance to them. And I think we should all kind of step back and know that we don't have all the answers just because we went to school the longest.
That's a great point. I think that, at least speaking from my role in the private sector, I have a little bit similar of a model, but of course different, right? We have a performance staff here, sports medicine staff that work together in the private sector, but two separate businesses. So it's a little different, but I'm going to ask you to go a little deeper on what you said about the transition, because I think they're oftentimes blurred lines per se. And I'll give you an example of what I mean, and maybe you can take this further with your perspective. Let's say an athlete's starting to return back to running. Let's say we got him on either an underwater treadmill or an anti-gravity treadmill, and I want to transition them over, and they're ready to keep pushing forward. Is there something objective you're looking at as, okay, I feel comfortable now with them transitioning over to our performance coach because he's really good at that sprinting mechanics, feeling the ground, pushing through. Is there something you're like marker wise you're looking for, or has he already started that process of running with the performance coach in those intermediate phases? Because maybe he can start wall drills, for example.
I think the best model is the model that there doesn't seem to be a dichotomy between the two. There's that middle point where both individuals are involved in conversation. And let's be honest, a lot of these coaches probably are better at cueing and getting the directives that we want for that task, probably better than PTs. So again, you work together as a group, and it shouldn't really have that split. Now, there are times where it's like, hey, we have a stress fracture, and I really got to be aware of how much load. Like, I'm sorry, but there's going to be a little bit more me involved in this, just because once you can't go back if this thing refractures. And, I think at least if you have a conversation early on of why am I going to be more involved in this rehab versus this hamstring strain that we dealt with, it's about the diagnosis and the pathology. And as long as you're open with that on a case-to-case situation, I think it shouldn't be an issue.
Yeah, no, I think that's a really, really good viewpoint. And that's why I want to dive in deeper with these things, because unless you're at that level and you're doing it every day, you can have, like you said, that idealism of what it should look like, but it's always changing. It's constantly changing case to case.
Now, you and I live in different worlds where we're basically we're very close to the strength coach on a day-to-day basis. The standard of return to play is different, and that's in most settings they're at PT, and then there's some loose communication between, hey, are you going on the field today with your whatever sport coach or your performance coach? Yeah. All right. I tell him I want these done. How much do you think that actually gets done? That's unrealistic. And it's actually pretty arrogant to say, I don't know what you do and whatever your skill level is, but I need you to do these 10 exercises. That guy or gal is going to look and say, nah, I'm done with that. And then nothing gets done.
No, listen, you're right. And I think that in private sector, it's similar with egos, right? If you're not on the same page, let's say that there's a strength coach or a PT down the street that your athlete's working with, you can give them a call and hopefully they're open to it. But, business is also on the line. And I think that's another unique challenge in private sector that maybe you don't get in professional team sport, but it's still a challenge, right? Versus this setting where I am able to walk through the doors into the strength and conditioning room and say, hey, this is what's going on with this guy today, right? And this is what's changed today. This is where he's at today. Or actually be able to walk into the strength room or the turf field or go to the field with the performance coaches or skills coaches and say, and just look, observe, right? Be their support. And that's a challenge too, because if you're separate businesses, and I think you probably can speak to this from the Exos side, you had everyone in-house, but you probably still dealt with people that were outside of Exos. And there is a business component to it, but I found that if you do what's best for the athlete, business takes care of itself.
Yeah, you got to come off of it from an authentic stance that really you just care about the athlete. It's not so much, are you going to get another $4,000 check from this player because you're relevant for the next 4 weeks? I mean, that's the thing that everyone is. It's a turf war, but you can't go about it like that with plan of care and taking care of your athletes. That's just, and to be honest with you, there is no type of patient other than the athlete that has a stronger BS meter, because from it, all angles, they're getting asked for, opportunities, money, etc. They're just always bombarded with stuff. They're always trying to give, and their exposure drives that opportunity for branding and other opportunities for other individuals. But if they sense that, it's about you, okay, I'm done. Like, I'm good. And they step back, but they have a really good sensor for that. So all you have to do is you got to show up. If you're the nerdy white guy that loves biomechanics, just own that. That's you. And they understand that. I go, oh, okay, yeah, he's cool. He's not shifting on me. It's not about, like, he's not trying to sell something. Like, okay, I trust Jess because that's him.
Yeah, no, and that's a fair point, right? I mean, athletes can read into that. I think a lot of PTs sometimes forget you're in a service-based industry. You're here to serve, right? You're here to be there for that person. And if you're genuinely into what you're doing and you love what you do and you're there to serve the athlete, it takes care of itself a lot of times. What do you think about other challenges that you've noticed between the private sector and professional sports teams since you've worked in both? Like, what are the biggest challenges and differences you see between those two worlds?
The big deciding factor is is money. If you're getting paid to work, they're going to look at you differently than if you're just the work staff that you see every day in pro sports, right? There's just going to be less attention. They might not be fully committed. I'm not saying all athletes. Some athletes are great pros and they get the system and completely see that the team has invested in a really good group of people. And then there's some athletes that just go, I'm good. Like you're represented by Big Brother, so I'm going to commit what I need to on a superficial level. But in general, I'm going to be a little bit more guarded versus in the private sector. Okay, I'm paying you. You might be my guy. I'm still trying to figure that out. If you're my guy, then there's embedded trust. You have more opportunities with this person, even in season. So, that's it. There's good things in both situations for sure, but it's different when they're paying for your services. The attention's locked in. They're a little bit more focused, and yeah, they're making sure that you know what you're doing on a skill level.
Yeah, you mentioned when they pay you, sometimes they become the guy, and sometimes the opportunities in season. I think you're seeing more and more of that in professional sports now, where athletes have quote unquote their guy, right? Maybe even travels with them. And I'm not saying all of them, but like you're seeing it more and more. How, as someone that probably has done that yourself in, prior to pro sport, and then someone that works in pro sport dealing with an outside consultant, tell me a little bit about those two worlds and how that mixes and the good and bad with that.
That's a tough question, man. I'll give it the best answer I got. It's all about conflict of interest, right? And it's on both worlds. There's conflict of interest embedded in pro sports. It's all about winning. It's all about, saving jobs, etc. And then there's conflict of interest on the other end where you're representing the player and you're making sure that they're getting the right care. But you're biased because that's the hand that feeds. So you're kind of split. There is no sport that is more dynamic when it comes to power than the NBA. The dispersion of power is spread much more diffuse than NFL, MLB, NHL, because the players have a lot of say. They have a lot of sway with the decisions with coaching, etc. They play with guaranteed money. So if they're hurt or not, they still make the same amount of money. And again, everyone's fighting for their contracts. So it's a little bit like Game of Thrones in regards to who are you connected with, etc. So that's in general a little bit different in pro sports. The power dynamic is pretty dynamic.
I would, that makes a lot of sense too with the way the contracts are and what you see in the NBA. What would you say is your recommendation then for, let's say, a practitioner or consultant that is working with an athlete in season and now has to interact with the medical team, performance team that is already contracted with that team? Like, what are best practices to make them feel comfortable?
Never confront. Because the big thing that I think is interesting is everyone points and says, look at what the medical team did here. Look, like, that's not good. And I get so annoyed of that because I've been on both sides. And you don't understand the complexity and the challenges that you have in the team setting, that these people that are the quarterback couch, they're sitting on the couch looking and saying like, oh, yeah, medical staff missed that one. So you can't be confrontational. You have to, again, not have a big ego, but you should be based on sound principles, sound evidence. Just be good at your job and be open to dialogue. If you're set with that, you should have no issues talking to the medical staff. And if they do have issues, they might be the ones that are not up to date with the evidence, et cetera. And now they might be a little bit more protective. But at least from your end, you're not the incompetent one. Like you come to the picture well-versed and prepared to talk about anything. but you're not going about it to see who's smarter. It's just that you're going to be a resource for that person, because in general, both of you have the same outcome. You want this person to be healthy. And I think you as a person from the outside need to express that. Like, how do we still work as a team? Though I'm not being paid by the team, we both have the same initiatives. Because if he's not healthy, then I lose my job.
Yeah. Now, on the other side of the coin, what about private sector and professional team sport working together in the off season? Let's say it's not in season now. Let's say it's off season. Is it similar communication? Is it different communication? You're still saying the same thing. You want them to be healthy, but what helps that? What can a private sector PT do to help the professional team sports sector? Right.
Well,
and
yeah,
vice versa.
I'm glad you asked that question, because that's not asked enough. Because there's a big ego check on the other end from the team perspective. When you go, time out, we've seen this guy for 7 months, 8 months. We know everything about his medical history. We know everything about the dude. So when we come to you and we bring instruction or saying, like, these are the things that we see in seasons, we have watched in season that needs to be addressed, you better listen to him. And that's the biggest thing that I get annoyed of from the other end, was there was just this kind of, all right, we're good. We can address it in a certain way. And it's like, no, like, we have objectives here. And the big thing that you need to do from your end, from the team perspective, is you need to gain some quantifiable metrics. You need to have some objective metrics to say, all right, this is where he came in and we want this better. And this is the direction that we want. Now, if they go off and go rogue and do their own thing, at least you can come back and say, these metrics weren't changed. You were with them for 3 months. And if you bring that to the picture, if that athlete has their guy, well, black and white right there, things haven't changed, and that's your guy. Like, I'm not here to, like, see who did a better job. It's just more, this is the outcome. Are you happy with it? And then he may look at that guy and say, well, what did we do this off season? It didn't change. Now that person has to have a tough conversation with the athlete to say why it didn't change.
It's a great point. And I think these are things that happen every day, right? I mean, we in the private sector, myself and the performance staff, work with off-season veterans for NFL, NBA, NHL all the time, MLB even. And I think that's our biggest thing, is there's so many different communication styles amongst private staff, pro sports staff, and we're always constantly trying to say, okay, how do we help make sure that this athlete ends up in a better spot and does what they need to do for their team, right? And how do we communicate that to the team? Or if we see something different or metric wise, how do we communicate that best to make sure that we're all working together? And it's harder in the off season for sure, because people take vacations, athletes are in and out, and there's so many things that are contextual factors that play a role.
Yeah. The goals from the team should be pretty simple. They shouldn't be complex goals. Like, hey, I need this quad to be, we need to see peak force from this quad. Whatever you want to do to get that, but we need to see it at this point, where we're addressing some of these issues that we kind of had a Band-Aid on the whole time, because he had patellar tendinopathy, but it was not something that he was going to sit out from. But now we have the time to address. So let's go over your standard continuum of a tendinopathy. And here are his numbers at the end of the season, and we'd like them there. And that might be a win. That might be the goals for that athlete.
That's great. Now, from a free agent perspective, let's say an athlete comes to myself or the performance staff in the private sector, and he's trying out for a team, or he's maybe going to get signed. He's obviously going to go through medicals with a pro team. I've been on the phone calls multiple times with teams to try to give background. What is, and usually I just have an objective list of force plate data, the actual surgeries, if they had a surgery, where they're at now, what they've accomplished. What do you want to hear from a pro sports side of things for somebody maybe that you haven't seen before that's coming in new? What's going to be most helpful to you as a staff member?
All of that, what you just said. To be honest with you, in the real world, you don't get that information. That's the standards that need to continue to get better from the private sector, is using technology, using, these are all advancements that we should be dialed in and trying to get better on a day-to-day basis if you're a PT or a strength coach. And if you're not, you're just saying, oh, that's not realistic, that I don't care about that. I care about the sport. I don't care about that data. Well, it's going to leave you in the dust, because we use that all the time in pro sports as well. So if you're bringing that package of objective information, we're going to listen to it, because it's, we may question the way you tested it to get a better understanding. So it's like, oh, okay, they tested it in that way. Okay, well, we would have done it differently, but at least we can kind of measure apples to apples with that. And also, you may use a different force plate system than what we use, but in general, data is data. And if you aggregate enough, you get a nice profile of an athlete. And then the other thing is, what we really care about is he a good teammate? Is he a good human? So there's as soft skills, subjective, questions as well, because we want to make sure we bring in somebody that's going to, enhance the locker room and be a good piece to the culture. So I find most of the time pro sports ask more about the subjective than the actual package that you can provide from the force plate data and everything else that you guys have there. They just want to know if he's a good human.
Yeah, for sure. I think I've gotten that first question every time I've talked with a team, a doctor, or an owner.
Yeah.
What are they like? What's their work ethic? Who they are as a person? What's their personality like? Can you have some fun with them? Are they more serious? Which is the same questions that you'll get on an interview when we're applying for a pro sport team job too, or any job, right? It's no different.
Yeah. The thing about pro sports that you don't know is there's two different ways to answer when it comes to character. It's a glowing review with examples and saying like, this guy's awesome, or it's, yeah, he's good. He's a good dude. That in itself gives you all you need to know. There's never that guy's an asshole, or don't take him. It's either glowing or this kind of mute point. But the mute point, it's just like, okay, we know we're probably not going to move forward with it. It's just this kind of, I guess, unwritten rule with professionalism when you look at pro sports. And then you scratch your head and go, why am I not getting a call? Well, there's not a glowing review.
Yeah. No, makes a lot of sense. So let's switch gears for a moment. I love where this conversation is going, but I'm curious. We've mentioned personality. We've mentioned, glowing reviews. Let's go to what you feel like is the most important traits for practitioners to have in order to be successful working within a high performance model like pro sport.
I think we kind of been talking quite a bit about some of these questions are leading to this one as well. And I feel like going into professional sports, every day you'll get humbled in some way. So you should take your little ego and fold it up and put it in your back pocket and don't let it out, because what happens is you have upper management, you have coaching, you have players, athletes. They're all getting fed first. Know that. They're getting the lion's share of the food, and that's okay with it. But medical and performance need to step back and be okay with that. Sometimes you're lugging luggage for the athletes. You're loading the bus. You're like, wait a second, this is not my resume. I'm the director of health and performance, and I'm going to be on this podcast, and I'm going to talk about all the things that we're doing from all the initiatives of tech and et cetera. And, you're in the cold lugging stuff onto the truck. So it's, as long as you know that you're going to be humbled, and you get humbled in private practice too. I tell my mentees, like, if you're not humbled at least 1 to 2 times a day based on your caseload, you're getting high on your own supply. Like you love yourself too much, because your interactions with your patients should always be getting more information to make sure that what you are doing, your heuristics and your biases, are being challenged to make sure you're doing the right thing. So that is also equivalent when it comes to the private sector. It's just in pro sports, there's just more egos to deal with. So knowing that, you just got to step back and work hard and keep your nose to the ground. And guess what? Sometimes even doing that, you still lose your job. That's just the nature of professional sports. It's cutthroat. But in general, you're going to survive longer if you're quiet, you work hard, you bring good energy, and you're competent in your job.
It's great. It's gold. I think a lot of people need to hear that, especially because there's so many younger clinicians wanting to work in pro sports, but they don't know what it actually is, right? Unless you're there.
No, athletes, coaches, they don't know what a OCS or a SCS or a FAAOMPT is. They don't care. And I think people that are on the outside validate that too much to say, why am I not getting an interview? I have this, this, and this. I've done the cookbook that I should be able to get in pro sports. I've done a residency from here. I've done my fellowship through here, and I work at this place. Why am I not getting a call? Like, that's just the reality of pro sports. The people that are making these decisions don't care about that.
Yeah.
They might get your first interview, but then from there, it's completely who you are, what's your character, and really, are you going to work hard? What's your work commitment? What's your work ethic? That's going to be more of the things that they're looking at. And if you're looking at a leadership role, how polished are you? How much can you take on stress? You know, how much can you be a professional and take that on and say the right things for the management to feel like, all right, this is our guy or gal.
So what do you think made you successful in landing your position with Portland and growing through the ranks to a director role? What was, because it was still your first pro sport job, right? Even though you had pro sport experience, but you have to learn it on the fly too. So what was it about your journey that made you successful in your eyes?
I feel that, first off, I'm a unicorn when it comes to professionalism. Like, the professional growth that I had, not to say that I was in the trenches. I was in the trenches for years before I even had a job where somebody like would be like, wow, that's pretty cool. Like, I went 5 years in my career before somebody actually cared what I was doing. But I do say that the level of when you walk into professional sports with zero experience, you're on a very steep learning curve. Even with your own staff, they're looking like, oh, he's our guy and he's 35 years old and he thinks he knows all the answers. Like, that was the situation that I was in. I was pretty young for my role and I had never had any experience. But for me, I had a role at Exos where I was managing athletes and I was leadership in a pretty well-known company, which then allowed me to get a phone call from Portland. And I was on a very short list of interviewees to go through. And then, I did what I needed to do. But what people don't know is I was the final candidate for the LA Dodgers, and I was the final candidate for the UFC PI, director of PT, 2 months prior. I had flown out to both, and I was told on both situations I didn't get the job. So then when I fly out to Portland, I already am dialed in on what I need to get better at. And I told my wife, I can't go 0 for 3. Like, this is going to hurt. So, my back was against the wall. But at least if you're making that final cut, and if you're still, working hard, and doing the things that you need to on a personal level with development, you should have chances. The problem is most people don't have those opportunities to make it through the first round. And that's where you need to start networking and get to know the people that actually have some sway, some actual power in hiring.
So what'd you do on the last interview that was different from the previous two? You said you made a change. Are you willing to share that?
No, I don't know what the change was. I will say I am
the most prepared person with all my interviews. I will go through the search engine of Google and I will look at all of the stakeholders. I will know where they're from, where they went to school. I'm looking for 6 degrees of freedom. And it's not anything that's, I'm not ploying or I'm not strategically trying to get them to trick them to hire me. I just need to make sure that I'm on point. And if I can make a quick connection between any of the people, that's critical. So I can't say that I changed anything differently between the three. I think it was just the culture. I just think that, hey, that guy is a puzzle piece that fits in this one. And in the other two situations, that did not work. And knowing what I know now, I would not have thrived in those two situations.
Makes a lot of sense. I think you brought up a lot of really good points already about some of these things that you don't hear unless you're talking to someone that has been through it. And I think that's the biggest disconnect between clinicians, practitioners that want to work in pro sport and actually people that have been in pro sport, because you don't hear them talk about it very often, not at this micro level, right? Not to the degree that you're talking about it right now. And I think you do that even with your new rehab code free education that you're doing, right? Can you tell us a little bit about, some of the stuff you offer on that, just from an education standpoint? Because I love that it's just out there and you're just helping people out.
Yeah, I kind of lost the things that brought me passion. As I elevated in my roles, there was less and less chance of doing the things that I love, which was teaching and mentorship. I mean, after 2 years of my career, almost switched to go to med school because I was so disenchanted by the PT profession. I was seeing way too many patients. I was burnt out. And then it was like, all right, I bought the MCAT book. I'm going to be prepared to make a shift and do all this more commitment education wise. And my wife's looking at me sideways saying, like, what are you doing? And I found somebody who switched my gear and said, oh, time out. There's a different level of standard here for PT. I just needed to be exposed to it. That's what I need. So for me, as I've been going along my career projections, I've lost that. And to me, at this point, it's like, I want to give back. Not only give back on an education piece, I want to give back on a career-wise as well. I want to help people. I want to connect. I want to make people that are good candidates will be aware of that next job. And I would rather be able to influence people on that versus, the top 10 exercise I do for shoulder rotator cuff pain. Like, that's just not what my IG is about. It's more about authentic, long form discussion about certain things, sports and orthopedic. And it's tough questions like you're asking me, where it's like, it's not the ideal answer. It's the real situations that we see every day in the clinic, every day when we deal with athletes. And just sometimes you're not motivated. I've not been motivated myself, but you got to find people that can recharge your battery. And I would like to be that person for people that are struggling.
Hey man, I follow it. I love it. I think that one of the things I've taken away from it so far is just, it's a different perspective, right? I mean, you're right. There's everything on Instagram or even email newsletters is exercises, the best exercises, whatever it may be. That's not important. What's important is these discussions, right? Going in deep and actually learning about the complexities of working with athletes or how to make things better, because nothing is ever perfect. And people that talk about things that are perfect it's just not the case. I mean, me and my other colleague, Matt, and the performance staff, we sit down weekly and we're like, some weeks we're like, pretty good week, right? Guys, we're doing well. Next week goes to shit. That's part of it. And that's real. And okay, how do you deal? How do you adjust? How do you adapt? And I think you're bringing up some points that selfishly I want to learn from, right? And this is why I do these podcasts too, to learn from practitioners like yourself that are open to talking about this stuff.
Yep. I think in regards to sports PT or sports rehab, we put there's too much influence happening from the academia level, because that's where research is created. And not to say that these people aren't overly bright, and I'm using their information to make decisions, to make presentations. Like, I'm using that to frame my clinical reasoning, but there's a level that you can only take from academia, and then there's the practical side. And again, I've been blessed to be exposed to both in both fields. I'm basically on my last year of my PhD dissertation on bioethics for wearable technology in the NBA. And why did I do that? Is because I'm sitting in the NBA asking guys to put devices on, and they're giving me a side look like, what are you tracking this for? And I'm starting to scratch my head and say, well, wait a second. It's not so much about the accuracy or reliability of this device. It's, why is this guy not giving me full effort on the force plate jump analysis? Wouldn't he think that that's valuable? It's supposed to help him. It's supposed to give us information to dictate our plan of care, and he's only giving us 50% effort. Well, then that jump is irrelevant. And now I'm scratching my head to say, did I say something differently? Did I not educate enough? So the PhD is aligned with getting the perspective of the athlete with all of this new tech infusion, all this tech that's being infused into our team setting. We got to understand the perspective of the athlete.
I think that's a great point. I mean, guys come here in the off season and they get force plate tested every off season that they're here as well. They get objective tested, whether it's a dynamometer or whatever it may be. But you're right. They're tracked at a different level in pro sport. And, a lot of times they're starting that process in college now as well. But it's different when they're getting paid to play a sport and when that information can be used to help them or maybe hurt them. I can understand both. I mean, agents talk about that to me all the time.
You know what? Your force plate data is better than mine.
I bet it is. No, I bet it is because I hate to say it, but a lot of times they'll come in here and they'll say, we trust you guys more. And it's a good and bad problem, because what I don't want them to do is go back to their team and be like, well, this guy said to do this, or this guy said to do this, or I like this better, because that doesn't help either. But I'm glad that they're putting effort in the off season. So those are tough conversations, and those are tough realities as well.
Yeah. And it's tough to ask somebody to do some metric when it's the third game in 5 nights and they're tired, and we got off the plane at 1:00 last night and we're like, hey, can we get on the force plates to see how ready you are for practice? He's going to say, ready? I'm not ready. I'm tired. Like, let's be real. Let's be practical about this. This is just life and the things that you see in pro sports that you don't see on your side. Again, I would buy all the data that you could give me with all the force plate information, because it's probably more relevant.
Well, they can come in here at 10:00, come up from Newport Beach and just come to our facility, do their force plate data when they're all good and ready, and be out by 1:00 over the beach all day. They're going to be a lot happier to do it. So yeah, exactly. Perspective. All right. Well, I've kept you for a while. So any final thoughts? I know we've talked for a while. I don't want to keep you. I know you got a busy schedule as well, but I appreciate you coming on. Final thoughts on these topics we've talked about? Any other things that we didn't talk about that you're like, man, I'm dying to talk about this. I'm passionate about it.
No, I mean, yeah, join me on Rehab Code. I want to keep growing that, just because I think I can provide some valuable insight, both from the professional team, private sector. I've done a fellowship. I'm doing my PhD. I've done OCS, SCS, etc. So there's a pretty good perspective from every angle that somebody actually has questions. So I could be a very valuable resource. And then I would just say, like I said before, don't be offended if you don't get the job. Like, that's life. And you just got to pick yourself up and know that you weren't the right fit. And you also need to probably find people close in your life that can give you some really authentic feedback. There's some people that want to be in pro sports or sports PT. They just don't have the personality. And somebody needs to tell them that. And it's not a bad thing. It's just you don't match up with the puzzle. So yeah, just find authentic feedback either through mentors or close people around your circle, and be okay to fail.
Awesome. I love it. You got a great newsletter. I'd encourage anybody listening to join that. You got great stuff on it. I subscribe. So Jesse, thanks for coming on, man. Thanks for coming and chatting with me. Kurt says hi, by the way. So he's in the other right now. He's waving to me. So
all right.
Thanks for coming on.
We'll say hi.
Soon.
I miss.
Have a great one.
Okay, thanks.